Hello there, sir. How can I help you today?
This is a street lane practice. We're based in Round A, Leeds.
That's it, let's get that for you.
We have 13,500 patients roughly on our books at any one time. We've got 4 partners in the practice, 3 salary GPs, and we cover quite an affluent area of this part of Leeds. Patients Online is a portal that enables patients to interact directly with the practice rather than turning up at the reception counter. Enables them to book prescriptions online. They can actually complete questionnaires online, which helps with the healthcare. And it gives them the chance to be involved more readily and heavily in their own care and health.
It really works for me. It saves time and it's just convenient. I can do it sitting in my armchair.
Online services are more flexible. I can access it as and when I want to.
Well, the repeat prescription one is very handy, and also making appointments.
Hello there to you. What patients usually say to me about having access online is it's fantastic.
It's much easier for them. They don't have to worry about getting through to the phones before 6 o'clock. They can go home, log on to the online access while having the tea even.
So when I go online, it's an easy process, but you need to go in, obviously, to the Street Lane site to start with. And then you get a menu option of all the things that are available from the practice and information, but the one you need to actually log on is the first box, appointment information and online access. And then there's a menu option of all the various things that are available to you. You can book appointments, and that can either be a telephone appointment or a meeting with your doctor in the practice. And then you can look at your current prescriptions and order online repeats quite straightforwardly. Just press request medication and then the prescription's available to pick up in the practice as usual.
The early part of the rollout was really just to help people to book appointments and to get prescriptions, and the appointments could either be on an app on their phone or using the website. But as time's gone by, the functionality's improved and we've been able to help people to access their full medical records and also to look, for instance, at their blood results and things like that. The view that patients have when they look at their records is the same as it is for the clinicians, which is to say they can look at the consultations, they can look at the prescriptions, they can look at their results and their outpatient letters. So this is a test patient, which means that which we use for training purposes. But this perhaps would just be the type of consultation I might document in somebody with newly diagnosed hypertension. So I suppose specifically from the patient point of view, it's documenting a diagnosis which potentially they could look up, but it's also documenting a plan for what we want them to do. Personally, I'm a firm believer in empowering patients to look after themselves and to manage their own health, and I think that the online access to records helps them to do that. So
here's my patient record, warts and all. So the last time I went to the practice was the 28th of July, and I saw Dr. Sheehan, and the summary of that meeting is absolutely accurate, give or take 1 or 2 typos.
We were getting requests from patients to view their records or their full records, and that takes time for the practice, typically a 30-minute appointment. We'd have to come up to a cupboard like this, extract the records, and just as an example, that's one patient who's had some issues, might have some chronic diseases or moved from surgery to surgery. We'd have to sort through all that with them and give them any copies they wanted. Another one patient's record. So you can see how much time would be involved. All that's converted to electronic and scanned and is on the system and summarised. They can look at all that, sat at home, having a cup of coffee, and come and discuss it with the doctor if they need to at a later point.
If a patient can access their records. It means often they'll have read around the significance of the result and the test itself, what it means, and it means that we can have a more meaningful discussion about the significance of the tests and a plan for the way forward from there.
The benefits of the practice is obviously time, effort, and we have to mention it, money. Any time we save, making things more efficient saves the practice money. The process of getting the repeats in, patients booking their appointments online, has saved all that time and effort for the reception staff and freed them up to answer calls more quickly or deal with other things that might be happening over the counter.
What can I do for you, sir?
Good afternoon, Street Lane Practice. The patient online access has made our jobs much easier. The phones aren't ringing as constant as they used to. We can get on with like day-to-day work, prescriptions, registrations, with paperwork, so we're more up to date with things.
From a GP point of view, it means less telephone calls to patients, so again less appointments that we're having to provide to sort of refresh information or to advise patients. So it just means that we have more time to see other patients and to do other things.
The online services is just an additional tool. Some people think it's going to replace normal GP services. That'll never happen. There's always a role for a face-to-face GP appointment. It just offers another avenue for patients to be able to contact practices and deal with some of their health issues.
I started getting repeat prescriptions first, then I found I could get appointments, and now I can get the records, so it's a complete picture now.